Imagine you're out and suddenly someone collapses in front of you. Their heart has stopped beating and they're clearly not breathing. Would you know what to do? Every waited second counts. In critical moments like these, CPR or cardiopulmonary resuscitation can be the very difference between life and death. Many people panic in situations like these because they don't know what to do. But by learning CPR, bystanders are able to help out a person's loved one before help arrives. Today, I'll be explaining what cardiopulmonary resuscitation is, why it's important, and how it helps save lives. CPR is used in emergencies and is performed when someone's heart or breathing stops and when they're clearly unconscious. The overall goal of CPR is to keep oxygenated blood flowing to the brain and vital organs until paramedics or more help arrives. When the body lacks oxygen, brain cells begin to die just within minutes. CPR acts as a pump to maintain circulation all throughout the body. CPR consists of two parts. That's chest compressions and rescue breaths. Chest compressions are done by pressing down on the chest at a steady pace, making sure to provide 100 to 120 compressions per minute. This can be done to the beat of Staying Alive to help keep you on track. These chest compressions manually pump blood through the body, mainly to the heart. The consistency and depth of chest compressions are critical because they ensure blood continues circulating. The depth of each compression should be about 2 inches deep. For performing rescue breaths, it is important to open the airway. This can be done by using the head tilt chin lift technique. This is done by placing a hand on the forehead to tilt the head back while lifting the chin with your other hand. This movement helps prevent the tongue from blocking the airway, allowing air to effectively reach the lungs. Rescue breaths help provide oxygen back to the lungs. When oxygen enters here, it allows oxygenated blood to be carried throughout the body, reaching all vital organs. Without enough oxygen, organs like the brain or heart begin to fail. Each breath should be given no more than 1 second and clearly make the chest rise and fall. Giving breaths too quickly or too forcefully quickly makes CPR less effective. Together, proper chest compressions and rescue breaths work to keep the body functioning until paramedics arrive. CPR sadly doesn't restart a person's heart, but it keeps the person alive until an AED, which is an automated external defibrillator, or paramedics become available. AEDs are commonly found in public places such as schools, gyms, and malls in case of an emergency. They're designed so anyone could use them. Once turned on, they provide voice prompts with clear instructions to save a person's life. The AED analyzes a person's heart rhythm to determine if a shock is needed to put it back on track. Studies have shown that with immediate and proper CPR, we can double a person's chance of survival after them experiencing cardiac arrest. The good news is that CPR isn't hard to learn. In fact, anyone can get certified. CPR certification classes are offered by health organizations such as the American Red Cross and the American Heart Association. These classes are offered both in person and online. During training, you will learn proper chest compression techniques for both adults and children, how to properly deliver rescue breaths, and how to use an AED. Taking the extra step to getting CPR certified allows one to be trained on how to respond quickly and effectively during medical emergencies. This means you could be the very one who saves a person who is experiencing cardiac arrest. CPR is a simple but powerful tool that anyone can learn. By performing chest compressions and rescue breaths, we can buy time for someone whose heart has stopped, giving them a real chance of survival. Remember to 1. Check the scene. Make sure the area is safe before trying to help. 2. Check for responsiveness. Firmly tap the person, asking them if they are okay. 3. Call 911 for more help. 4. Begin chest compressions. Make sure the person is lying flat on their back. Place the heel of your non-dominant hand in the center of the chest and put your dominant hand on top. You're going to push hard on the chest, making sure you reach 2 inches in depth. If trained and comfortable, you are to deliver 2 strong rescue breaths for every 30 compressions. Repeat until help arrives. CPR is not just for healthcare workers or first responders. Anyone can need CPR at any time, whether that's a family member or a friend or even a stranger. It is important to remember that doing something is better than doing nothing at all. Even if you feel unsure about your abilities, starting CPR can keep blood flowing to the brain, increasing a person's survival chance. Acting quickly with CPR can save lives.